Hi everyone, and welcome to our module on helminths. Helminths are also called worms. They are multicellular organisms that can cause infections in humans, and there are several different types of helminths. The roundworms are the nematodes, and these are worms that are long and stringy, sort of like what you see out in the garden in the dirt. Then there are the flatworms. The tapeworms are called cestodes, and tapeworms look like ribbons. And the flukes are called trematodes, and flukes look sort of like flat leaves. And all of these worms have three stages. They all lay eggs, and then the eggs grow into larvae, and then the larvae can mature into adults. In general, the helminth infections are fairly low yield. You're unlikely to see them clinically, and at most, they are going to represent one or maybe two questions on your board exams. So what I'm going to try to do is go through each of the infections and then give you a few keywords that you can just remember, which should help you recognize the infections when they're described in a question stem. And on this slide, I've broken down all the different helminths into groups that share common features. So up at the top, I've written all the roundworms or nematodes. And there are some roundworms which infect the intestine. Those are called the intestinal roundworms, and others that like to infect the tissues. And some things that are common among all those that infect tissues is that you can diagnose these by visualizing the worms, with just one exception, and we'll talk more about that later. For all of the roundworms that infect the intestine, you usually make the diagnosis by some type of examination of the stool. There's just one exception, which we'll talk about later. And in general, these can all be treated with drugs that are either bendazoles or parental pamoate. For the worms down at the bottom, these are the tapeworms or cestodes and the flukes or trematodes. And in general, the diagnosis of these infections is complex and it's fairly low yield for you to worry about. Another thing that's common among the tapeworms and flukes is that they can usually be treated with praziquantel. The one exception is echinococcus, which we'll talk about later. That's this one right here. But otherwise, you can think of praziquantel as a treatment for all of these helminths down at the bottom of the screen. So first, let's review a couple general principles. Helminth infections are very rare in the developed world. They almost always cause eosinophilia. So if they present you with a board question and the number of eosinophils in the peripheral blood are elevated, one of the things you should think about is a worm infection. And there are various modes of infection, but two of the common modes are to either ingest the eggs or to have the worm or the larvae penetrate the skin. There are many unique drugs used for therapy of worm infections, and these are drugs that you won't see used anywhere else. One of the most common classes are the bendazoles. These are drugs like albendazole and mebendazole. And then there are others that are used in various worm infections, ones like ivermectin, parental pamoate, diethylcarbamazine, and finally praziquantel. So I've listed here on this slide things to know about the worm infections, and I've listed them in order of importance. The two most important things to know are the name of the organism and the symptoms. Often on the board questions, they will just ask you to recognize the clinical presentation. If you feel solid on these two items, then you can worry about things like how the patient gets infected or how you diagnose it. It's often a stool analysis and the various treatments for the different infections. So going back to our summary slide, I'm going to start by going through the intestinal helminth infections. So these are infections like Enterobius, Ascaris, Trichinella, Strongyloides, and finally the hookworms. And all of these are roundworm infections that affect the GI tract. Enterobius vermicularis is the cause of pinworm, and this is the most common helminth infection in the U.S. It's very common among children because they often touch dirty things and then put them in their mouth, and that's how they get infected with pinworm. So these eggs are found in moist environments, and a child will touch the eggs and contaminate their fingers, and then the fingers will touch their food or their mouth, and they will ingest the eggs. What's interesting about pinworm is that the eggs hatch in the small intestine, and then the adult deposits eggs in the perianal folds, and this is where the symptoms come from. Those eggs are going to be very irritating around the anus of the child who is infected. In addition, the eggs that come out of the intestine of an infected child can then infect another child potentially. Most infections are asymptomatic, but the most common symptom is perianal itching. So there's inflammation from reaction to the worms or the eggs on the skin around the anus. And this occurs predominantly at night. So these children are going to have an itchy anus at night. There's a very unique test for pinworm. It's called the Scotch tape test. So you apply adhesive tape to the perianal skin and then you place it on a glass slide. And under the microscope, you can easily visualize the eggs. And this is one of the infections that you can treat with the bendazoles like albendazole and mebendazole. You can also treat it with parental pamoate. And what I'm going to try to write at the bottom of all these slides for you are 3 or 4 buzzwords to remember about each infection. And the thing to remember about Enterobius is that it occurs in children, it gives them an itchy anus, and it has the Scotch tape test. If you know these 3 things, you will likely be able to identify it in a board question. Ascaris lumbricoides is also called the giant roundworm, and this is a very big worm. Pinworms are small, but this is a very big worm. It's found in warm tropical climates, and just like pinworm, it's common in children who have dirty hands that they put in their mouth. And this worm is so big that there are reports of children vomiting up worms that you can see with your naked eye. It's nasty. These worms live in the small intestine of infected patients, and then they shed eggs in the stool. And the eggs go into the environment, and then other children touch them, and this results in fecal-oral transmission. That's why kids most commonly get this, because they tend to do the most dirtiest things with their hands and put them in their mouth. When the eggs are ingested, they hatch in the small intestine, and then they release larvae which creep into the intestinal wall and penetrate it and then migrate via the blood or lymphatics. It is creepy to think about these things crawling inside someone's body. Now, most patients with an Ascaris infection are going to be asymptomatic, but the two organ systems you should always remember for this worm are the GI tract and the lungs. So those larvae, once they penetrate the small intestine, can cause inflammation. And in fact, Ascaris is one of the most common causes of bowel obstruction in some underdeveloped countries. In addition, the worms can migrate to the lungs and cause pulmonary symptoms like cough and shortness of breath. This is called Loeffler syndrome. It's an eosinophilic pneumonitis from worm migration to the lungs. You can diagnose the giant roundworm by seeing those eggs on the stool examination, and this is a picture of some of the eggs in the top right corner here. And you can treat Ascaris with the bendazoles and also with parental pamoate. So the classic case is going to be a patient with recent travel to an underdeveloped country who has abdominal pain, wheezing and cough, elevated levels of eosinophils, and eggs seen on the stool exam. And down here at the bottom I've written the buzzwords for Ascaris, and that's bowel obstruction, pneumonia, and eggs in the stool. The next intestinal roundworm is Strongyloides stercoralis, and this one is different because it penetrates the skin. You don't get this by ingestion of the worm or the eggs. So the larvae of Strongyloides are found in the soil, and if it gets onto your skin, the worm can penetrate the skin, and then it migrates via the blood to the lungs, where it penetrates the alveolar air sacs. Now, I told you this is an intestinal roundworm, so why am I talking about the lungs? Well, the reason is because once it penetrates those alveolar air sacs, it can ascend the tracheobronchial tree, and then you swallow it. So then it gets into the intestine, where it matures into adults and burrows into the duodenum and the jejunum. So what's interesting about Strongyloides is that it's an intestinal roundworm, but its path to the intestine is very unusual. It penetrates the skin, goes up to the lungs, and then ascends and gets swallowed, and that's how it gets into your GI tract. So once you understand the path it takes to get to the belly, you can understand the symptoms. So there are often skin reactions like a rash and itching, and this is from the worm penetrating the skin. There are pulmonary symptoms like cough and throat irritation and wheezing and sometimes hemoptysis. And then once it gets into the intestine, it can cause duodenitis. So people have belly pain and diarrhea, they have poor appetite and nausea and vomiting. And one thing you may want to remember about Strongyloides is that you will not see eggs when you look at the stool. You will see the larvae. And the reason you see the larvae is because of this unique life cycle. It's not like you ingest the eggs like some of the other worm infections. It gets to the belly after going through the lungs and being swallowed, and by that point the eggs have hatched and they are larvae. You can also detect it with serologic blood tests. And the treatment is one of the bendazoles, albendazole, and another medicine called ivermectin. So the buzzwords here for Strongyloides are skin, belly pain, and cough. Those are the three things I always remember about this worm infection, and that reminds me that it penetrates the skin, gets into the belly, and also goes through the lungs to give you the cough symptoms. The next intestinal nematode are the hookworms, and there are two species of hookworms. The first one is called Ancylostoma duodenale, and the second one is Necator americanus. In both of these hookworm infections, the worms live in the small intestine of infected patients, and eggs get shed in the stool. What's interesting about hookworm infections is that you don't get it by ingesting the eggs. The eggs hatch in the soil and turn into larvae, and then the larvae penetrate your skin. So in order to get sick from a hookworm, there have to be infected patients living nearby you, and those people have to get elements of their feces into the soil, and then the soil has to contaminate your skin. Once the larvae get into the skin, they migrate to the blood where they're carried to the lungs. This is very similar to Strongyloides. They ascend the bronchial tree and get swallowed, and that's how they get into the intestine. So just like with Strongyloides, this is an intestinal worm infection, but it doesn't get into the intestine by ingestion of eggs or worms. It gets in through the skin. I told you that these worms live in the intestine of people who are infected, so you can imagine that the major impact is on nutritional status. The worms are attached to the intestinal mucosa. They cause blood loss by ingesting blood, and this is facilitated because these worms can produce anticoagulants so that they can get blood out of the capillaries without having the blood coagulate. People who are infected with hookworms daily lose blood and iron and albumin, and they get very anemic and they get very malnourished. And you may see pictures of children who are malnourished in developing countries. Some of that is just from lack of food, but sometimes it's also because they're chronically infected with these hookworms. You can diagnose these infections by examining the stool and finding the eggs, and you can treat them with the bendazoles like albendazole and mebendazole, and you can also treat them with parental pamoate. And the buzzwords for a hookworm infection to remember are skin, skinny, and anemia. So it gets in through the skin, it makes you very skinny through its impact on nutrition, and it makes you anemic. And then the last intestinal nematode we'll talk about is trichinella, which causes trichinosis. And trichinosis is something you get if you don't cook your meat. One of the many reasons that we cook meat well is so that people don't get this infection. When the larvae get inside your small bowel, they mature into adults, and then they migrate to striated muscles. So the symptoms of a trichinella infection are muscle weakness, which is very unique and unusual among these Helminth infections. And the classic biopsy picture they like to show you is what's up here in the top right corner, and it is the larvae of one of these helminths in the muscle. This is the muscle of the tongue, and it's very creepy to think about this thing living in the muscles inside your body. You can diagnose it by looking for antibodies, but also by biopsy, like is shown right here. And you can treat this with the bendazoles. And when it comes to trichinella, just remember meat and muscles. It's really all you need to remember to know how you get this infection and the symptoms of this infection. So that's the last of the intestinal nematode infections. So let me just summarize some of the key points to remember. There are 3 of these intestinal nematodes that make you sick by ingestion of eggs. So enterobius, which is pinworms, ascaris, and trichinella. And trichinella, remember, you ingest the cyst. 2 of them make you sick by skin penetration. So strongyloides and hookworms both get in through your skin, and then remember, they go to the lungs and then get swallowed and get into the gut. Most of these are diagnosed by some examination of the stool. The exception is pinworm, where you do the Scotch tape test. And usually in the stool you see the eggs. The one exception is strongyloides, where you see larvae. And most of these are treated with bendazoles and parental pamoate. The one exception is strongyloides, which you can also treat with ivermectin. So back to our overview of the Helminth infections, we began by discussing the roundworms, and I just went through all the intestinal roundworms. So now we're going to talk about the tissue roundworms. So all of these Helminth infections infect tissue. They don't generally give GI symptoms. The symptoms are related to which tissues they invade. And in general, the way you diagnose all of these is by visualizing the worm somehow. Toxocara is one exception, but for all the rest of them, you're going to actually see the worm somehow to make the diagnosis. Dracunculus medinensis is also called the guinea worm, and this is a very easy Helminth infection to remember because it's an enormous worm. It can be up to a foot long and it can burrow into the skin. You get infected with dracunculus by consuming unfiltered water that contains small crustaceans called copepods. Crustaceans you may know of as crabs, but there are other crustaceans, and some of them are very small, and you can drink them with water. The copepod dies, and it spills the larva inside of it into your intestine. The female adults then migrate to the skin. Up to a year later, the worm will migrate to the skin surface, and a painful papule will develop. And then the worm will emerge, and it causes a burning sensation. And the only way to treat this is to slowly extract the worm. It can take several days or weeks of pulling it out a little bit at a time. So it's very easy to remember this. Just remember it's the giant skin worm. And let me show you a picture of it. So here's a picture of someone who's got an infection with dracunculus, and the worm is being pulled out of their skin. And as I said before, you may have to pull it out slowly over days or weeks because you don't want it to break off while you're tugging it out from inside the body. Very nasty and creepy infection, and very easy to remember. It's got this bizarre name, dracunculus. It almost sounds like Dracula. Onchocerca volvulus is the cause of river blindness. You get this Helminth infection from the bite of a female black fly. It deposits larvae into your skin. These larvae mature into adults, and then the adults make offspring, which are called microfilariae, and these are the problem. These microfilariae move through your tissues. They move under the skin and the subcutaneous and dermal tissues. They like to go to the eye. That's why it's called river blindness, and they also go through the lymph system. While they're alive, they provoke just a mild immune response, but when they die, this is the problem. They provoke a significant inflammatory response, and this is what causes a lot of the symptoms. So if you remember what I just said about how the microfilariae move through the body, it's easy to remember the symptoms. So they can cause skin symptoms from getting into the dermis and subcutaneous tissues. People can have itching. They can get nodules called onchocercomas, and they can get many other skin symptoms. And then in the eye, it can cause inflammation of the cornea, that's called keratitis, or inflammation of the uvea, that's uveitis, and this can ultimately lead to blindness. That's why it gets its name river blindness. You diagnose it by doing a special kind of skin biopsy called a skin snip, where you take a little bit of the skin and you examine it for presence of microfilariae, and you treat it with the drug ivermectin. So the buzzwords to remember for onchocerca and river blindness are itching, blindness, and skin snips. And the name river blindness reminds a lot of people that it affects the eye, but you don't want to forget that it moves through the skin and makes you itchy. Loa loa causes loiasis. This is the African eye worm. You get this worm if you get bitten by a deer fly, either a horsefly or a deer fly, and the fly introduces larvae into your skin, and the larvae penetrate the bite worm and then mature into adult worms over several months. The adults live in the subcutaneous tissue, but they migrate to other areas, especially the eye, hence the name. And the diagnosis of loiasis is often made by visualizing the worm swimming across the eye of an infected patient. It can be swimming across for up to 20 minutes. Very creepy and nasty. So most people with loiasis are asymptomatic, but the two main clinical manifestations are subcutaneous swellings. These are called Calabar swellings, named for a place in Nigeria where they're common. And then, of course, the migration of the worms across the subconjunctiva of the eye can cause eye symptoms. These worms measure up to 7 centimeters. They're long, and as I said before, you can visualize them crossing the conjunctiva. It often takes 10 to 20 minutes for the worm to work its way across the eye. You can diagnose it by visualizing the adult worm in the subcutaneous tissue or in the eye, or by doing a blood smear. And this is treated with a drug called diethylcarbamazine. And so the buzzwords to remember for loa loa are eye worm and skin swelling. Most people remember the eye worm. This worm has a very unique name, and most people remember that picture of the worm swimming across the eye. What people sometimes forget are the Calabar swellings and the skin symptoms, and that's because it moves through the subcutaneous tissue, just like a lot of the worms we'll talk about in this module. Lymphatic filariasis is a Helminth disease caused by several different worms. The first one is called Wucheria bancrofti, the second one is Brugia malai, and the third one is Brugia timori. All of these helminths are transmitted by mosquito bites, and the larvae migrate to the lymphatic system. They grow into adults over months, sometimes up to a year, and the bottom line here is that they obstruct the lymphatic flow. So people with filariasis have massively swollen extremities, usually legs, and it's because their lymphatic ducts are blocked by the presence of this worm. And this is a picture here of someone who has filariasis, and you can see how the lower extremities are massively swollen. It's a very disfiguring condition, and the legs are swollen like that because the lymph ducts are obstructed by this worm living in the body. So the symptoms are lymphedema and elephantitis, which basically just means swelling of large parts of the body. There's massive non-pitting edema. It's important to remember that lymphedema is non-pitting to differentiate it from the type of edema you get in patients who have heart failure, for example. The tissues will get hardened over time, and they can become hyperpigmented. And the major problem here is disfigurement and disability. People can have trouble moving because their limbs are so disfigured. You can diagnose this by doing a blood smear and seeing the microfilariae. A key finding is eosinophilia, so someone who looks like this and has eosinophils in their blood smear definitely has filariasis. And you can also treat this with the drug diethylcarbamazine. And so the buzzword here is just to remember elephantitis. When you hear the term filariasis or you hear any of these helminths mentioned, think of the person in this picture here to remember the symptoms that it causes. The last tissue roundworm is Toxocara, which is the cause of visceral larva migrans. And this helminth is not a natural human parasite. It likes to live in dogs and cats. There's one called Toxocara canis, which lives in dogs, and Toxocara cati, which occurs in cats. Children get exposed to this by playing in playgrounds and sandboxes that are contaminated with pet feces. Once the children get the Toxocara inside their body, they will develop hepatitis and pneumonitis because the larvae migrate to the liver and lungs. Eosinophilia will be present, just like it's present in many of these helminth infections. And you can diagnose it with serology, looking for antibodies to the worm. And the treatment for Toxocara is bendazoles like albendazole and mebendazole. So the classic case is going to be a child who plays in a sandbox or eats dirt, and there's going to be mention of cat or dog exposure. There'll be wheezing or dyspnea, and this is often going to be in a child with no history of asthma. And then there's often right upper quadrant pain and hepatomegaly from the liver involvement. So the buzzwords here are to just remember cats, dogs, and kids, and liver and lungs. It almost sounds like a rock and roll lyric or something. And these 5 words together really remind me of all the things I need to know about Toxocara. Back to our overview of the helminths. So I discussed all of the roundworms or nematodes. I talked about the intestinal roundworms and the tissue roundworms. And now I'm going to move on and talk about the tapeworms or cestodes. And in general, for the tapeworms and the flukes, the diagnosis is fairly complex and it's low yield and not worth you learning about. Another thing that is similar among most of the tapeworms and flukes is that they can generally be treated with praziquantel. The one exception is echinococcus, which causes giant liver cysts. These have to be surgically drained and treated with albendazole. We'll talk about that in a minute. But other than that one exception, you can just think of praziquantel as the therapy for all the tapeworms and flukes. So first let's talk about Taenia solium, which causes teniasis. And the way you get teniasis is by eating raw or undercooked meat. Usually it's pork because this helminth likes to live in pigs. So if you eat meat from a pig and you don't cook it well, you can get this infection. What happens is you ingest the larval form, which is called an oncosphere, and when you ingest it, it goes into your intestine and matures into a tapeworm. Most infections are asymptomatic, but when people do have symptoms, they're usually mild GI symptoms like nausea and poor appetite and belly pain. A major clue in someone with non-specific GI complaints is the presence of eosinophilia. When you see that, you should think of tinea infection. You can diagnose this by finding either the eggs or segments of the worm called proglatids in the stool, and you can treat this with a drug called praziquantel. And I just remember this is the meat tapeworm that goes to the gut. A related disease to teniasis is called cysticercosis, and this is caused by the eggs or cysts of Taenia solium. It's very important to understand that this condition is not from undercooked pork. The way you get cysticercosis is that tapeworm carriers, so people who are infected with the tapeworm, shed the eggs in their stool, and then someone else will have fecal oral ingestion of those eggs, which will then hatch in the intestine. So often when someone gets cysticercosis, there's another member of the household who is a carrier of the tapeworms and shedding the eggs in their stool. Very important to understand that when you ingest the larvae from undercooked pork, you get teniasis. When you ingest the eggs from fecal oral contamination, you get cysticercosis. Once the helminth gets into your bowel, it can invade the bowel wall and disseminate, and it can travel to muscles and liver, and it especially likes to travel to the brain. We'll talk about that in a minute. Over a few weeks, the tissue forms of tinea form. They're called cysticerci, and these are little membranous walls filled with fluid. And classically, what you get is something called neurocysticercosis, where you get multiple cysts in the brain. And in underdeveloped countries, cysticercosis in the brain is a major cause of seizures. And one high-yield thing to know about this is if you hear of someone from an underdeveloped country who has seizures, one thing you should think about is that they may be infected with this helminth. And this is a fairly classic MRI image of someone who has neurocysticercosis. You can see lots of these black circles. Those are cysts in the brain. And this person is going to present with seizures. So the key words to remember here are eggs, brain cysts, and seizures. And that will help you remember cysticercosis. And it's also important to spend a few minutes making sure you understand the difference between cysticercosis and teniasis, even though they're both caused by the same helminth. Diphyllobothrium latum is a tapeworm that's very similar to Taenia solium, but instead of getting it from pork, you get this from eating infected fish. And the unique thing about infection with Diphyllobothrium that they want you to know about is that it causes a B12 deficiency. So patients who are infected with this tapeworm will become anemic, and the helminth has an affinity for vitamin B12, so it competes with the host for the vitamin. So even though someone may be eating enough B12, it'll all be going to the worm instead of to the person. So the patient will get all the classic symptoms you know of B12 deficiency: a macrocytic megaloblastic anemia, hypersegmented neutrophils, and neurologic symptoms like paresthesias and subacute combined degeneration. And really the main thing to remember about this helminth is the B12 deficiency. Echinococcus granulosus is a helminth that causes giant liver cysts. That's the most important thing to remember about it. It's got a very usual name with the word coccus in it. It almost sounds like it might be a bacteria, but it's not. It's a helminth. Dogs are the definitive host, and they shed eggs in their stool. And then when people don't wash their hands and touch contaminated soil and dirt, they get fecal oral ingestion of the eggs. When the eggs hatch in the intestine, they penetrate the mucosa and they enter the blood and lymph system, and the first place they like to go is to the liver. So like I said, the main clinical problem is liver cysts, and they can become massive, greater than 10 centimeters in size. Patients will have an enlarged liver on exam and right upper quadrant pain. If you want to be a superstar on your clinical rotations, especially with a gastroenterology attending, mention echinococcus as a potential cause of hepatomegaly and right upper quadrant pain. The cysts can sometimes rupture, and when they do, people can get a fever, and they've been known to trigger acute hypersensitivity reactions, even sometimes an anaphylactic reaction when the cysts rupture. You have to treat these with surgery, and one interesting thing they do is they pre-inject the cyst with an agent to kill the parasite so that it doesn't spill all over the body and trigger a reaction when they open up the cyst. They often inject it with hypertonic saline and ethanol, and this will kill the helminth. And then after surgery, they give adjunctive therapy with albendazole. And the main thing to remember about echinococcus is that it causes giant liver cysts. So back to our overview. Now we've gone through all of the roundworms and all of the tapeworms, and I'm going to finish this module by discussing the flukes or trematodes. And just like with the tapeworms, the diagnosis is complex and fairly low yield to worry about, but the treatment is praziquantel for all three of the flukes that we're going to discuss. The first fluke is schistosoma, which causes schistosomiasis. So these worms live in snails, and the infectious form, which is called cercaria, emerge from the snails and contaminate water. And once they get into the water, they can penetrate the skin of humans. Over a few weeks, the worms migrate through your tissues, and they develop into adults inside of blood vessels. Then they produce eggs that will deposit in the bladder and the intestine and the spleen and the liver. And the important thing to know about schistosomiasis is that it's not the worms that are the problem, it's the immune reaction to the eggs. These eggs stimulate a lot of inflammation and scarring over years, and that's what leads to all of the problems. There is sometimes an acute reaction to the cercaria getting into the skin. It's called a swimmer's itch. Sometimes people get a hypersensitivity reaction with fever and urticaria or angioedema. This is uncommon. Mostly the acute infection goes unnoticed, and it's the chronic infection and the reaction to the eggs later that causes the problem. Chronic schistosomiasis can affect almost any organ. It's a multi-system disease, but some key ones to know about are the GI tract. So people with schistosomiasis get abdominal pain and blood in the stool. And then it's very high yield to remember the genitourinary tract. People with schistosomiasis can have hematuria, and the chronic inflammation can lead to squamous cell carcinoma. And make sure you remember this as a potential association with squamous cell carcinoma of the bladder. In the liver and spleen, schistosomiasis can lead to hepatosplenomegaly and also portal hypertension. And another high-yield thing to remember is that schistosomiasis is one of the many causes of granulomatous inflammation. So most people know that tuberculosis causes granulomas, most people know sarcoidosis does, but schistosomiasis is a sneaky one that a lot of people forget, and it can come up in a board question. And the treatment is praziquantel, just like for all these fluke infections. So for schistosomiasis, I remember snail, skin, squamous cell, and granulomas. These are really the key features of schistosomiasis to know about. Clonorchis sinensis is the Chinese liver fluke, so it's found in southern China and also places that are close to China like Korea and Japan and Taiwan. And you get infected with this helminth by eating contaminated fish. So just like in schistosomiasis, the eggs hatch in snails and develop into cercaria, and the cercaria are released into the water, but instead of directly penetrating human skin, they penetrate the flesh of fish, and then when you eat the fish, that's how you get sick. And these flukes ascend and reside in the biliary tract, and that's the source of a lot of the pathology. So people with Chinese liver fluke infections get biliary tract inflammation and obstruction, so they can develop obstructive jaundice and they can get pancreatitis. And then there are two special complications you should know about. The first is development of pigmented or bilirubin gallstones. This is a very rare type of gallstone. It's seen in people with hemolytic anemias, and it also occurs in people with this helminth infection. And then finally, the long-standing infection of the biliary tract can lead to cholangiocarcinoma, and this is treated with praziquantel. And the key thing to remember here is just fish in the gallbladder. That's what I think of when I hear about this. I think of people eating contaminated fish and getting gallbladder disease. And then our final fluke is Paragonymous westermani, which you get from eating raw or undercooked crayfish or crabs. These flukes migrate to the lungs and they give you hemoptysis. And a classic finding is chocolate-colored sputum, which contains blood and inflammatory cells and the eggs of this helminth. You can diagnose it by seeing the eggs in a sputum sample or a bronchoalveolar lavage. And you treat this with praziquantel. And I just remember coughing crabs when I hear the word Paragonymous infection. And that concludes our module on helminths.